let me first introduce myself. So my name is Simcha Jong. I'm the professor of management and healthcare innovation at the UCL Global Business School for Health. I joined UCL in June this year to take over the lead of the DBA program. So my background, it's really in the social sciences. I wrote my PhD on the history of the biotech industry and the role of academic institutions in the growth of the biotechnology industry throughout from the beginning of the industry till now. So I joined, as I mentioned, in June. I'm not new to UCL. I did my career. I'm a social scientist, but did my career in departments in science engineering faculties, focusing on issues around technology, commercialization, innovation, in particular in life sciences. So I was at UCL School of Management from 2006 to 2016, where I helped set up new programs in the healthcare management domain. Then I spent some time at the Harvard School of Public Health, where I worked on questions around innovation and health systems. Then I became a professor and director of a unit called Science-Based Business, and linked to the medical school and the Faculty of Science of Leiden University in the Netherlands, where I was responsible for developing new management entrepreneurship programs for scientists and biomedical students. And so I rejoined UCL in June to take up the leadership of this program. So I'm very excited about your interest in the program. So I'll talk a little bit more about who we are. So we're the UCL Global Business School for Health. We're the first business school dedicated to health. What we've seen that there is a real need for a business school dedicated to health in the life sciences healthcare sector. And we're looking at leadership needs in this sector. Most leaders, managers, policymakers, they don't come in through the traditional business school routes. They typically have science, biomedical research, technical training, and but there's a really urgent need we see in leadership expertise training specifically tailored to the needs of the healthcare sector, which are very different from a lot of other sectors. So what we want to do is to really reimagine global healthcare management. So as we all know, healthcare, the life sciences industry is going through a period of profound change. So we're looking at the whole digital transformation of healthcare, the rise of AI, the emergence of new disease threats, which we've experienced throughout the COVID-19 pandemic, an aging population require also all kinds of new challenges, which really bring forward the need for a new cadre of leaders who can deal with those very complex challenges. So really what we do here is we question the status quo in healthcare management to inspire the public good. And so if we're, for example, looking at those sustainable development goals, health is interwoven throughout all these challenges. And so that's what we are trying to achieve here at the UCL Global Business School for Health. So why do a DBA? So the DBA, it's really our aim is to, so it's a very selective, small program where our aim is really to train the thought leaders of tomorrow, professional thought leaders of tomorrow in the healthcare field. So what we'll do in this program, we'll train you in very advanced research skills to examine and address the health sector's key challenges that we're facing. So really provide thought leadership on the key questions in your particular professional field using on a foundation on a solid foundation of rigorous scientific thinking and reasoning, and also based on scientifically rigorous data analysis. So the program, it's so really the aim is to help you develop further in your career, move from your current position within your individual organization, and help you also gain visibility within your broader field of professional activities, and become this thought leader in this particular field. Therefore, so this is a so it's a doctoral degree. So we have a very strong emphasis on rigorous scientific training, but the focus is also very much on professional development. So in the second year, we also have a specific module where we focus on communicating, helping you communicate your research, gaining visibility in your professional field, and so how you communicate and market yourself as a thought leader in your field. We also have professional training and coaching support for our students. So it's really a two-edged sword there, where we're focusing on both on professional development and your development as training as a researcher, practitioner researcher. So so why DBA? So we have a very what we offer. Of course, UCL, we are a leading international research university. It's a very international faculty, and what you will do throughout the program is to immerse yourself in the research environment that we have at the Global Business School for Health, and I'll talk a little more about that in a second. So our research it's global in its reach. So the focus is really, we have various types of focuses. There's also hospital social care focus, field work. You'll be doing field work in your project. We have both applied and theoretical researchers who can help you in your development. And and we have internationally leading research going on here, and generating a lot of data in our own research that you'll be also able to use and rely on in pursuing and building your own, starting your own research project. And then finally, of course, the Global Business School for Health is part of the faculty of population health at UCL, but we're based on the new UCL East campus, which experienced its grand opening two weeks ago. And our focus here, it's really a very interdisciplinary focus. And in the research community here at UCL East, across UCL, our focus is very much an interdisciplinary one. And the program also, you'll have teachers, professors from across the UCL research ecosystem. So in terms of the highlights and the program design, so this is a program designed for professionals who are studying and working at the same time. So all our students, they have very demanding professional careers, and our program, it's really tailor-made to accommodate those needs. So there are really three parts of the program. So years 1 through 2. So years 1 and 2, it's really about taught. It's a taught program where we're delivering online content, an asynchronous learning experience, where you're able to access the content at your own pace, when you have time. But we come together once every term during those first 2 years to really immerse you in the research environment that we have within the school, within the on the UCL campus at UCL East. So yeah, these first 2 years, we're focusing first year on really providing you the conceptual, theoretical building blocks you'll need in the healthcare management research field. We'll have modules on research design, data analysis, both qualitative data analysis and quantitative data analysis. During year 2, we go a bit more in depth into various areas of healthcare management research where we are seeing particularly interesting development in terms of health systems research, digital health. We have separate modules on that, and as I mentioned, there's a more professional module on communicating, creating visibility for yourself as a researcher. So yeah, as I mentioned, it's a distance-based learning, with the exception of these 1-week residentials on the UCL East campus, and we have some wonderful executive training facilities that you'll be able to access. And again, the emphasis is throughout the program to really immerse you in in the research environment that we have at UCL. So if you might have noticed, so this year we've been named by the Times Higher Education supplement as the University of the Year. We are second in the UK for research power, and first in the disciplines of medicine, health, and life sciences in the important UK research assessment exercise of 2021. You'll be attending a top 10 ranked university according to the Shanghai rankings, and this top 10 position we achieve in most of the rankings that are available there. And of course, when you're here in London, there's the experience of London as really as this global city that's a leader in health and business, where we have all these leading research universities, medical schools located in London, UCL, Imperial College, of course, School of Tropical Medicine. And so London is also a leading cluster for healthcare innovation in the business domain. Yeah, so we really understand the DBA. So how does the DBA Health program stand out? So we are a business school dedicated to health. So we really understand the healthcare sector. Health is integral to everything we do. There have been our programs have been specifically designed for aspiring healthcare leaders with cutting-edge contemporary topics. So we have researchers, lecturers from who are world leaders in their research, with a range of interests across the healthcare management field. And we have a recruitment agency working with us to develop, evaluate, and work with you to ensure you achieve your expectations from the program. So as a UCL, so leading this program will lead you into sort of the community of UCL alumni, where you have access to the executive education that we are offering at GBSH at significantly reduced rates for lifelong learning. And so we have networks connections worldwide that will last you a lifetime. And in this respect, I particularly would like to draw your attention. So on our website, you'll be able to see we also have this health executives in residency program, where we have real sort of leaders from across the global healthcare landscape, practitioners, who are leaders in their particular fields, from very senior positions in industry, who have committed themselves to helping our students in their professional career and helping them gain access to also to research sites and cases that you might use in your research. And those so our leaders from across sort of leaders from healthcare management, so leaders of hospitals, consultancies, so KPMG, from industry, so pharmaceuticals, from really the entire range of the entire health sector innovation ecosystem. So what we're looking for, so we've enrolled our first cohort this year. So our typical students, they're sort of mid-range, higher, later sort of more senior managers in the health sectors. So health professionals wanting to gain an applied research background to drive forward an evidence-based approach in their career. So they tend to be senior staff wanting to enhance, refresh their skills and knowledge without taking a career break. So we have quite senior DBA students this year, including a CEO of a large biomedical company. Individuals who have either completed a master's degree or MBA, who are looking for the next academic challenge to make a difference to health and healthcare solutions. And professionals really looking to pivot into healthcare management research. So as I mentioned, really what we're trying to do is train these thought leaders in the healthcare field, so we're really able to reshape the health sector going forward. So this is really a professional doctorate degree. So for students who want to stay in industry, as I mentioned, this is a largely online, it's a hybrid degree with a very large asynchronous online learning component, with a week of in-person learning during the every term during the first 2 years of the program. So we have in year 2, you'll be working on an advanced professional portfolio, allowing you to reflect critically on practice within your organization and sector. And then there's this strong, of course, it's a doctoral degree, a research component, allowing you to develop skills in the critical appraisal as well of research questions, as well as the ability to develop the rationale methodology and methods for research. So it's a 4 to 5 year part-time program starting in, so we're recruiting now for the intake starting in 2024. Applications are currently open until the end of June next year. And there are the fees, which are the same for UK and overseas campus. And during your residencies will be based on the wonderful new UCL East campus with really state-of-the-art executive training facilities. On the old Olympic Stadium site. So this is the program structure that I already talked about. So these first 2 years where you will have these termly residencies on campus combined with online learning. Part 2 involves the preparation of this professional practice portfolio, and part 3 it's the big research project that is the outcome of your degree. And once you finish the taught components, but not the thesis, you can also, there's the opportunity to get a postgraduate diploma in research degrees for business administration in health. So if for whatever reason after 2 years you decide not to write a DBA thesis, you'll not lose those 2 years, and you'll do get a postgraduate diploma for for the successful completion of the taught component of this program. So so what we're looking in terms of admissions, we're looking for, of course, excellent students with a master's or a completed MBA degree, where you have a upper second, at least an upper second or other overseas equivalent, or graduates without the relevant degree but with extensive relevant work experience in the sector. So there's the language requirement, which is very important. So you should already be in the health. So this is really a professional degree where students, they have extensive experience in the health sectors, in the sector. So and if your previous experience is from outside the sector, you should use your application to demonstrate a strong desire to pivot into the health sector. But again, our current cohort, it's a cohort of students with extensive, I would say, at least around five years of experience managing projects in the healthcare sector. So as I mentioned, the applications are opened until June 24. There, as part of the process, there will be 2 interviews, one with myself and with another colleague. We will be assessing your personal motivations or personal statement, and we require 2 references for the application. So as I mentioned, we're a school at one of the world's leading research universities. So you'll be able, I think this is just some examples of some of the professors we've been recruiting to our school, who you might be working with. So as the director of the school, we have Professor Nora Colton. She's a professor of leadership and management for healthcare. She's worked extensively across the world, with an emphasis on Asia, the Middle East, Africa. And she's worked with health systems leaders on reorganizing and designing, implementing new health system policies. Leadership and innovation. We just this year recruited Professor Kabir Sheikh, who has worked for WHO on universal healthcare coverage for several years, who has honorary appointments across universities in Australia, in academic institutions in India, and also here in London at the School of Tropical Medicine. And so he joined us as a full-time professor this year. We have Professor Sotiris Vandros, who's a leader in the area of health economics, behavioral economics, working on regulation and competition in pharmaceutical markets as well. And there is myself, so I'm a professor of management and healthcare innovation. I've worked on innovation projects with companies, researchers at academic institutions working on new technologies and sort of implementing those in health systems, in healthcare organization. Precision medicine, it's a particular research interest of mine. Worked with companies, with health systems, looking to redesign health systems for an era of precision medicine. I've worked on R&D in the life sciences, sort of how pharmaceutical companies can optimally organize their R&D, and digital transformations in healthcare in both the rich and some projects in sub-Saharan Africa there as well, working on digital transformations for health. We have prominent researchers in the operations field focused on healthcare. Dr. Rodolfo Catena, who joined us from Oxford. We have Sonia Tumini, another lecturer working in health economics. We have Professor Julie Davis, who's really who's the director of the MBA health program, really a leading authority on the in the area of leadership development. And we have Professor Adam Dubis, who's the program lead on the digital health and entrepreneurship program, who has experience as a healthcare as an entrepreneur in the life sciences industry. And yeah, has also developed research in that area. So yeah, so we have some other upcoming events that might be of interest. And yeah, so we have a website with extensive information about our program and any questions you may have. But yeah, of course, we have on this open days, we have a we have some time as well for questions and answers. So if you have any questions, do raise your hands or put your question in the Q&A where you can type in your questions. So yeah, so we have a first question about the fees. So I mentioned the fees. They are £64,000 over 5 years of studies, which is yeah, so priced quite competitively. But the question is why the fees are the same for UK and international students. So the main reason is this is a yes, this is a professional executive training degree where yeah, UCL they don't distinguish between UK and international students, and UCL is very similar in this respect from to other universities. So another question is regarding the entry requirements. So if I have an undergraduate degree but no master or MBA, however, I have 5 years of experience in the healthcare sector and medical research funding sector, am I still eligible to apply? So the answer is in short is in principle yes. But we will need to get so you do not meet one of the entry requirements, so we will probably UCL yeah, so that has some additional checks we do in those cases. And I've had one of these cases this year where we asked the student applying for the program to write a brief essay reviewing the literature in a particular area of relevance to the student's field of professional practice, to have some sort of test of the yeah, sort of research proficiency, so that you're able to, yeah, at a relatively abstract level identify interesting questions in a particular field. So yeah, so still eligible to apply, but yeah, do contact with me about that, and we can yeah, look at the yeah, so there's some sort of yeah, some sort of additional assignment probably we'll have to give you to admit you to the program. So a third question. So hi there, thanks for the informative session. Thanks for that. Can I please ask if candidates with experience in pharmaceutical biotech industry apply to this program, or is it only open from healthcare students from a healthcare delivery background? So this is definitely a program for the yeah, we're a global business school for health. It's a DBA for health, so definitely the pharmaceutical biotech sector, it's a critical stakeholder in the health sort of the life sciences healthcare ecosystem. This year we had, as I mentioned, the CEO of a pharmaceutical company joining the program. My own research, so we have quite a lot of professors, researchers doing research on the biopharmaceutical role of the biopharmaceutical sector in the whole health sector ecosystem. So we have professors working on this, students working on this. So definitely we very much welcome students with this background. There's a question about the typical cohort size. I think that's a good question also. So this year we aimed for a student intake of 10 students, and we ended up with 12, 13 students because of the very high quality of the applicants. So I've joined the program in June, so I'm not really able to answer any questions about the acceptance rates, but I can because I wasn't really I was only involved quite late in the process in the selection process, but I would say it's quite a so the quality of the applicants this year was very high, so I think the acceptance rate was quite high as well. So Christopher King wrote, looks very good. I will certainly apply, but can you give me a sense of the time commitment per week or month or term? So I think that's a very good question. So as I mentioned, this is a program designed for students who have a busy professional sort of their working at the top of their field, and they have busy professional careers. But we do ask the students to come during the first 2 years to come to campus 3 times per year for these very intensive residencies, which are really designed as immersion in the research environment at UCL. So you'll be really full-time working on your studies during those 3 weeks. During the 5 weeks preceding to the residencies, it's focused on asynchronous learning, so you can access online content, do some small exercises at your own pace. So that will take that's designed to take about 3-4 hours per week. And then after the residency, you'll be focusing on your, so you have 4 or 5 weeks of term left. And basically what you'll do is take that learning from the residency and focus on the final assignment for the term. And again, the sort of the time commitment we're looking at is around 3-4 hours per week. So then I have a question. Can you please provide more information on the thesis? How many words? You have a priority list of topics to research. So typical UCL. So there is some information that I showed on the slides. So the maximum word count of the thesis, it's 45,000 words for the thesis. Most theses are shorter than that. And the research topic, it's really up to the student. So typically the topics will be in line with your own professional, sort of the part of the health sector ecosystem you're in and where you want to develop your career. So that's really up to the students during the first 2 years. So I'm really busy now meeting students, really helping them define their broad research interest. And then, those first 2 years, it's really about immersing yourself in the literature and finding your specific research needs. And then, of course, it's my job to help you find a supervisor. So which also links into the previous question. So about the cohort size. So this year we recruited 10 students, And we're really looking at a maximum cohort of 15 students because, of course, it's very time intensive for us to supervise students. So we have we cannot, I think every professor at UCL can supervise a maximum of around 3 students, 3 PhD DBA students. So we are very capacity constrained. So we have a maximum cohort size of 15 students. And so in answer to the question, what's going to be the research topic? It's really something that you'll develop on your own in the first 2 years. And then we'll match you to a supervisor professor who's able to supervise that particular topic. So about the career placement opportunities. So there's a question about career placement opportunities post the course or during the course. So this is really, so what we're looking at is creating thought leaders in the industry. So students, typically they're, as I mentioned, we have some more advanced students as well, leading divisions or entire organizations. We have a CEO of also a CEO of a healthcare organization in the US this year. But what we are really trying to do is to help you gain visibility, not only within your own organization, but within the particular ecosystem in your particular professional field through your thought leadership, and thereby also help you in opening up more senior level professional job opportunities that require you to be a visible figure in the particular field you're active in. There's a question about scholarships or grants from funding organizations. So this is a executive program where there is a professional degree, where at the moment they're very limited scholarship or grant opportunities. So all the students this year, they're either self-funded or funded through their organization. Okay, so we have another question. My purpose of pursuing a DBA program is to end up researching on a topic research area that can be commercialized and integrated into our consulting business. To that end, a pure academic pursuit isn't what I'm looking for. Can I please check if this program at UCL will enable such an endeavor? So so this is a program directed at practitioner researchers. So part of the questions that we'll ask during the interviews, so how does this program fit in your career aspirations? And this clearly is not a program for students who want to pursue a research degree. So yes, so this is I think this is and it sounds like a very sensible program for the purposes outlined here. To focus on a particular area in a professional field, and then take that and then create value through that research in the context of your own professional career or in the context of your own organization. So if successful after 5 years, are we allowed to use the title doctor before our names or just DBA? Yes, so this is a doctorate degree. So yes, that comes with your ability to use the doctor's title. Yeah, so I hope I answered all the questions. Are there any other further questions? No, so then so I thank you very much for this very engaging discussion. So I think there's one Someone raising. Let me have it. Yeah, there's one participant raising the hand. So yes, I provided you the opportunity to ask a question, and so you can unmute and ask a question.
Hi, Doctor. This is Dr. Shilpa here. I was wondering what are the career opportunities that you would be offering to people once during the span of the course or post the course, if some of us are trying to move into the healthcare sector?
In terms of, so of course, we are offering, so this is a professional research degree. So there's the research training component, but also, yeah, so there is we have this training, coaching support, professional, so building we have support, so this module about building your own brand, communicating your thought leadership, establishing yourself as a voice in a particular field. So that will be helpful, I think, in making connections and creating career opportunities for yourself. More to your question, probably, I think it's useful. So we have this health residency. So these health executives in residency within at the Global Business School for Health. And I think those, for our current students, those provide really useful, valuable connections in opening specific career opportunities.
Right.
So
Thank you.
I answered your question. So yeah, you can have a look at our website. We have a very long list of who those health executives in residency are. So those are from healthcare organization, health systems, from industry, from really from consultancy, finance, so really from all parts of the health sector. So I have another question from someone online. Can this program be finished in less than 5 years? The answer is yes. So there are some deliverables. Of course, you need to complete the thought component of the program, and in the first 2 years. So if you can do it in 3-4 years, that's perfectly fine. In fact, I think 5 years is quite a lot, and you'll be able to save a little bit on your fees as well in that way. Any final questions? No? Then I really thank you for all your interest. If you have any questions, you can contact me directly. And good luck with all your professional careers and in finding a program that's right for you. Goodbye.